nurse in Brampton, Ontario. So we're just going to go over some of the medication that I encounter as a foot care nurse on the job to some of my residents itself. So the first one we're going to actually look at here is ACE inhibitor. So what does ACE inhibitor do, and what medication? What's the name of the medication itself? So ACE inhibitor, it helps relax blood pressure and lower, so the blood vessel, sorry, and lower the blood pressure itself. Some of the medication you would look at in that field is lisinopril, ramipril, and enalapril. So this is some of the medication itself. Some of the consideration you want to think of when you see those medication on your field, because again, as a food care nurse, I have to assess what medication they're on. Some medication is very highly, highly you had to monitor it highly itself, or maybe you would give the resident some teaching regarding, depends on what medication he or she is on. So definitely some of them nursing consideration, you want to monitor the blood pressure, potassium level. So it's monitoring the blood pressure pretty much. Monitor potassium level, kidney function, and watch for cough itself when the resident is taking these particular medication. Now, the other one we're going to look at here now is calcium channel blocker. So it relaxes the blood vessel and slows the heart rate. That's this medication there. So what we're going to look at is some of the names that you would see, of course, in your nursing practice. Again, for me, as a food care nurse, some of my residents may be on these medication. Although as a food care nurse, you may be dealing with the feet, but again, you want to know the resident on a whole, because that also impact how you care for the resident, or how you would educate the resident itself, based on the if they're diabetic, if they are edema, and so on and so on. You can give them health teaching as a nurse itself. So amlodipine and diltiazem is one of the two medication, a consideration medication itself for the calcium channel blocker. That's what's seen most itself, of course, in a nursing home, or at least I see as a food care nurse for the resident. So some of the consideration and monitor for edema, dizziness in the client itself. Now, of course, when we look at the another one, this is something that is very, very big. I encounter a lot with my clients itself. Diuretic medication, the water pill. So it helps remove excessive fluid and reduce, of course, the blood pressure. So that one I encounter a lot, because some of my clients, they may have edema. Their feet may be swollen really, really, really big. So as a nurse itself, I understand the situation is sometimes the situation is really, really dire. But again, as a nurse, you want to give health teaching. So of course, you want to make sure that, or at least just ask them if they're on any Lasix or furosemide. So that's some of the medication itself that you would actually see in these patients as well. Some of this patient, I would say. So furosemide, Lasix, if they're not on it, you want to encourage them to talk to their doctor about the water pill, especially if they have their leg, because you are doing with their feet, their toes, right? You want to make sure that just encourage them if they're not on it, or if the doctor didn't recommend it. You wouldn't want to say, you definitely need to be on Lasix or furosemide. Another one is a hydrochlorothiazide. So that's another one there itself. So some of the consideration is monitor electrolyte, dehydration, and potassium level. So electrolyte, you want to make sure that the water is not retaining. You want to make sure that they are going to the washroom, they are peeing, because it's very important. Or else if the water have nowhere to go, then of course that's where it boil up in the leg. It causes a lot of complication, and you definitely want to educate them as a food care nurse in general. All right, so again, we're just looking at some of the medication that I encounter as a food care nurse on the field. And of course, as a nurse in general, you definitely want to educate your residents, or you want to know about some of the medication they may be on, so you could actually educate them accordingly. So beta blocker. Some of the beta blocker we have here now, I encounter again, and these are regular medication. If you're working in a nursing home, you would see those medication for sometimes they have a long list, and again it's a short list, but again, many of the residents may be on one or two of these medication. So beta blocker, sorry, lower the heart rate and the blood pressure there. So some of the medication, the names you might be familiar with is metoprolol. So that one I see that all the time, and atenolol. So when you see that lol, it's a lower the heart rate and of course the blood pressure. So some of the nursing consideration, you want to monitor for the pulse if the heart rate is too low as per policy. So basically, some nursing home itself or some resident may get particular instruction based on when to take the medication, when not to take the medication itself in general. All right. So what I'm going to do here, I just want to. This is just a general nursing just a consideration itself. So always check the blood pressure before administering the medication. So in this case here, as a food care nurse, you may not be giving medication to the resident itself. However, as a nurse in general itself, if you work in a nursing home, these are some of the consideration here. So follow any whole parameter itself. You want to make sure if there's any specific physician instruction for the medication, you would definitely want to follow it accordingly. If the systolic is too low, the heart rate is too low, you definitely want to go according to the order. Monitor the orthostatic hypotension. So basically, when the resident is standing up, the blood pressure drop itself excessively. Those it does increase fall at a high rate. So definitely want to monitor that there, especially in elderly resident. Watch for fall risks after taking blood pressure medication. So it's very, very important there. All right. So even as a food care nurse, it's always good to do all your assessment because you're a nurse in general. If you go into the resident home and you see certain thing that doesn't look right, you don't just go do their feet and walk out the door. It's not ethical. You definitely are responsible once you enter the resident home as a whole, because of course, once you do their feet or you go there to do the hands itself, you do have to document and ensure that everything go accordingly. So sometimes you could even document how you receive the patient as well, the assessment of the patient itself. So again, as a food care nurse, doesn't exempt you from any of those. You still have to follow your ethically, of course, your nursing scope. So follow ethically itself, not just go, I'm a food care nurse and that's it. No, absolutely. At that point, you with the resident, whether it's half an hour, you're still a nurse treating a patient itself. All right. So let me just look at a few question here. So hopefully I can see the question clear. A resident is in a long-term care home, is prescribed lisinopril 20 mg daily. So before administering the medication, you assess the blood pressure, and it's 92/58. So that's you have to look at there. The heart rate is 72. Resident reporting feeling a little dizzy when standing. So what is the best nursing action itself? So you have to look at the situation here. So you want to assess the blood pressure. You would look at the blood pressure. You would definitely see the blood pressure is too low. The heart rate is above 60, so it's not that bad. But again, you want to monitor the heart rate. You don't want it too high. You want it to be within stability rate. So you want to look at this. So one of the red flag we look at here is the blood pressure itself. So what do? One, do we administer the medication as order? Well, after all, it's already order, regardless of the blood pressure. I give the resident the medication. Is that way we're gonna do it as a nurse? You want to hold the medication and notify the physician. Okay, that's another option there. You want to encourage fluid and recheck the blood pressure next week. Well, that's a red flag. When you see next week, it's like, I don't think so. Maybe I'm not even working next week, right? Or you want to give half of the medication. Well, do you want to change the dose? Did the order for half of the dose? So you want to consider what would be your best action itself. All right. So to reveal itself, of course, it would be for hold the medication and of course notify the physician. That would be our best course of action if we are working directly with the client, of course, in the nursing home, or maybe we are a private nurse itself giving the resident medication in his or her home. Definitely you want to make sure that you hold the medication and notify the physician immediately for the next course of action. And again, there is so many different things you could do in this case as well. Of course, you could recheck you definitely want to recheck the recheck the blood pressure again, but of course not next week. Absolutely not. You don't want to change the dose of the medication. Absolutely not. And of course, the last thing you would ever want to do is to administer the medication itself as a nurse. That would not be ethical at all. So resident is hypotension. That's the situation there. Dizziness, low blood pressure, of course, increased fall. That's a high risk of fall if you want to get the medication there. I could definitely drop the blood pressure to the point of falling. We don't want that. Nurses must follow all the whole perimeter and assess safety before administering, of course, any medication. You cannot any medication according to order, because some medication you may not have to check the blood pressure before you give, but again, according to order protocol. You cannot independently change the dose, of course. So why would you want to change the dose? And given given the medication, of course, would worsen the situation. So B would be the most critical, would be the best answer in this case. Now let's look at another question here. So another question we have here is beta blocker. So cardiac assessment. So a resident is prescribed metoprolol 50 mg twice daily. Morning vital sign read. So 118/70. Okay. Heart rate is 72. We see the heart rate is a little low. We also see the diastolic is a little bit high, but the heart rate is low. So resident denies symptoms. So them, I'm fine. So what should the nurse do first? All right. So we're going to look at this critical here. What should the nurse do first? So let's look at some of the answers. Yes, the nurse just administer the medication. After all, the resident say, you know what? There's nothing wrong. I'm fine. Hold the medication and reassess apical pulse. All right. So that one you have to somewhere around here, but you have to kind of search it up so you could actually see exactly how to find that pulse. Or you can say the heart rate. Document and continue care. So you know what? After all, I have to continue care. I have a lot of residents I have to take care of. Give them medication and monitor later. So what would be the best course of action in this case? All right, so when you want to look at it here, you want to look at first the heart rate itself is low. That is a big hint there. Even though the resident may deny anything, you definitely want to use your critical thinking, nursing judgment itself, and you want to hold the medication and reassess, of course, the pulse itself. Now, because it's a blood pressure medication, you see, blood pressure medication, that's the thing. Sometimes in some nursing home, there's no, because one nurse have 30 residents. So let's say 20 of the residents is on metoprolol, right? So there's not all the time there's an order to check the blood pressure before you give, although probably it should be. But again, I'm just saying that's just how it is in a nursing home. In the nursing home, so many residents is on so many different medications. So again, you can't check all of them because eventually you'll be, but some particular resident may have specific order that you would have to check the blood pressure. So if that is your finding in this case, you would have to hold the medication and reassess, of course, the pulse. So in my question, it's a apical pulse. So you want to check the pulse itself, and then let's look at it critically now for the rationale. So the beta blocker is lower the heart rate. So we see the heart rate is already low, right? You definitely don't want to give the medication there because you would continue lowering the heart rate. The heart rate is 52, so that's bradycardia. All right, you don't want to be in that situation where you use the one that caused the situation to get worse. Whole per minute are required if the heart rate is lower than 60. So once you have an order itself, except the order is otherwise stated, you want to follow the order at all time. The nurse must reassess the apical pulse before deciding itself. All right. So what I'm saying here, guys, always want to follow your physician order, regardless if you have a long list, because those little tiny things could actually make or break your career. If you go to look on the CNO, you will see there's different There's different what you call it, where nurses may go on hearing and different hearing, and you may read the hearing, and sometimes you may see, you may look at something simple, but again, it's something critical, because nursing is not, is not an easy game. You always have to think critical, especially when you have clients life at stake, or in your hands, or in you are the one, you are the nurse, you are the one they look up to. So absolutely, you always want to follow the order accordingly, and document. You cannot sorry, you cannot stop documentation. Lastly, we're going to look at one here. All right, you arrive. So this one is more this one is actually directed towards me 100%, because now I'm actually on the field as a foot care nurse. I don't do the bedside nursing, at least for as per this video. So you arrive to provide foot care for a resident who recently received morning antihypertensive medication. Assessment findings. So you have the BP, the blood pressure is 90/58. Resident reporting feeling lightheaded when sitting up. All right, and now in your case now, in that particular case, you would have to get the resident up. So what do you do? Now, in some cases, you could do the resident feet while they're lying down. But in this particular question here, what do you do? So schedule for full foot care treatment, required chair position. So that's pretty much what it is. They are scheduled for foot care full treatment, and they require sitting up position according to maybe whatever the foot care nurse um state in her agreement, or whatever the case may be. But that's the question we are looking here. So what is the nurse priority action? Okay, so let's look at this here now. So one, process. So you want to proceed with the treatment. So that would be one of the questions we asking, we trying to answer here. So proceed with the treatment quickly. B, delay treatment, reassess blood pressure, and ensure resident stability before continuing, of course. Continue treatment but avoid nail trimming. That would be for C. And D, ask the resident to stand to improve circulation. All right, at least you have a lot of clients on the go. What do? You have a lot of clients to see. What do you do? All right, so that's it here. So what would be the answer? What would be the nursing priority action? We're looking at priority action, not just, okay, you know what, I have 10 clients, or I have 5 clients, or I have whatever client to do, and I must go, go, go. What is your priority as a nurse? Not just foot care, whatever, just as a nurse in general. So you definitely want to delay treatment, reassess the blood pressure. In a case like, let's say, for instance, they may have a blood pressure monitor in their home, or maybe you as a nurse, maybe you want to follow with having your own blood pressure monitor in your own practice, right? Because you're a nurse, you just never know where you could face with. Then either you delay treatment. If to say there's a blood pressure machine around, you take the blood pressure, or if you yourself have a blood pressure, again, you think critically as a nurse, you reassess the blood pressure and you ensure resident stability. So you always want to make sure the resident is stable before you continue care. So critical thinking here, hypotension increase the risk of cisco and falls during repositioning. So it's Cisco. Cinsco, I think is the word here. All right. So Cinsco and fall during repositioning. Foot care should be postponed until the resident is stable. So if you had to reschedule the appointment, or if you could delay the appointment itself, or come back another day, that's fine. So safety and assessment always come before procedure. So that's one thing as a nurse you always have to follow in general. All right. So now let's go here. Hold on, I want to just come here. Now, so this was the question here. So just to give a last word in here, as many seniors take diuretic and blood pressure medication, so as a foot care nurse, our responsibility is not only the feet. That's the thing. First, you're a nurse and you're going to the client's home, right? They trust you. So you must assess the resident on a whole, hydration status. Maybe you may not go in hiding, but again, you could look and assess as a nurse. The person, oh, wow, your lip is very dry. Maybe you could give education, right? You could always give it education. Ma'am, do you drink a lot of water? The parent said, no, I don't like water, and stuff like that. So hydration status and stability before starting treatment is very, very important to follow as a foot care nurse. So my practice is foot care nursing with Gellis. I do offer foot care treatment in Brampton, Ontario, and Mississauga mainly. If you or anyone know of anyone that might need my service, we are accepting new clients. And definitely, this is our information on the screen. You could give us, you could contact us, of course, if you need services. Now, in this channel, we're going to always look at maybe some of the medication we encounter or some helpful tip for our patient, helpful tip for students itself who want to get into the foot care aspect or just in nursing in general. Definitely, you are in the right place. Again, my name is Gellis, and this is Foot Care Nurses with Gellis. See you on our next topic.